Hey guys, Bjorn here. Just wanted to talk you through a little bit of what my takeaway was from the pharmacology course, and how I thought you could best use your time, or just give you something to start trying and make your own adjustments as you see fit, obviously. So this is kind of what I took away. I think you need to buy the Katsung review book. It says Katsung on it and like Lang. It's almost as thick as the real book. Uh, but I don't know, I thought it was good enough, and it's got really good questions in it that the real book don't have. So the biggest reason you want is for the questions, and you also need to have a Dropbox account so you can access the tables that classes before you and your own classmates have made and will be making and adjusting based on current knowledge. So it's really two courses. Pharmacology is the autonomics section, and then it's the everything else section. So I've kind of got that here, autonomics and everything else. And you could kind of say it's 2.5 because antibiotics and antimicrobials kind of don't fit the mold of everything else. So maybe you just say 3. Maybe just say it's 3 different courses within the pharm course that all your grades go to the one course. It's kind of like 3 courses. So I'm really going to focus on these 2, and I'll say something briefly about autonomics. So I got really good advice from students ahead of me, one in particular who's a 4th year now, who was just like, man, I wasted so much time trying to learn autonomics, and I wish I would have just learned the system and learned what each drug does. So I've kind of laid it out in a step here. Your job is to learn the pieces of the system so that you can manipulate it on the test. So you need to learn what each receptor. These are the main sympathetic receptors, and for examples in this presentation, I'm only talking about sympathetic receptors. You'll also have to do that with the muscarinic and nicotinic, the acetylcholine receptors. So you need to learn what each of these does. And I mean, I have a practice problem down here in a minute that we're going to work on. And here, this is really the nuts and bolts. Like when I think of this receptor, I got to think it does that. Think of this one, it does that. And that's really integral. You got to start with that. And when you know what each of those receptors does, then you need to map them out in the body, okay? Map them out so you know. So this is my drawing, and it's messy, but I made it, so I'm very familiar with it, And from this, I know that here's my beta-1 receptors in the heart, and I know what they do in the heart. They make the heart go faster. So I have down here, you can see beta-1 makes the heart march fast. So anyway, I'm saying too much here, but really you need to know what each receptor does. You need to know how it does it. That's your second messengers. Don't get too stressed about that. First aid for the 2012 version, page 263, makes it really simple, gives you mnemonics. Anybody can learn it. I refer to that page all year, like, oh, I'm dealing with this IP3 pathway or CAMP, second messenger pathway again. I'll just take a glance at it. Glance at it about 1,000,000 times and you'll know it, okay? And then map out. Yeah, okay, so I said map out. And then you just have to memorize. So you want to memorize the receptors in clumps, just like they are in Werner's drug list. Like, it's good enough to know, here's a list of 5 drugs that are predominantly alpha-1 agonists, and you just memorize your drugs like that. So I made flashcards. I did it 2 ways. I like to learn it one way and then learn it backwards to really make it redundant for me, but I would just learn, like, okay, list the beta-1 blockers, and then in my mind I would try to do that, and that's kind of hard to just come up with a whole list all by itself, but give it a try and some of it'll stick. And then the other flashcard that I make, I used Anki, and the other one that I make would be I just list the name of the drug and the other side of the card would be beta-1 blocker or new drug, clonidine, alpha-2 blocker, So drug on one side and what it did, which of these it affected, and was it a blocker or an activator, and that that really did it for memorizing. Everybody memorizes differently, so I'm sorry if I am wasting your time telling you how to memorize. And you've come a long way with your own memorization skills, so do what you do to memorize those. And as you're memorizing, I would flip-flop. Memorize some and then go do CAT-SUN review questions. And keep your drug list in front of you as you do CAT-SUN review questions. So as you're doing questions, you will be memorizing, not by rote memorization, but just by again and again referring, oh yeah, I'm pretty sure that one was an alpha-1 agonist, and then look at your list of alpha-1 agonists. Oh, what do you know? You were wrong, it was alpha-2. So that kind of thing is really good. So with steps 3 and 4, I would flip-flop, go back and forth, keep this list in front of you, your drawing, so you can always refer to it. You want to see these things a million times, till you really know where all those receptors are and what they're doing. And so I have a sample question here. This is the kind of thing you'll see a lot of on the test, and I'm using it to illustrate that I really want you to do CAT-SUN questions as soon as you've got your system sort of defined and you're ready to start memorizing it. Do some rote memorization, but do a lot of your memorization through doing questions. It's more of an anecdotal, learn a little bit here, learn a little bit there type of memorization, but I think it's really good. And so, for instance, if you saw a question like this, which drug was administered at the green line, you're going to see a lot of those kind of things. And I'm just going to take you through this problem. If you happened, I'll tell you what you need to know to answer this problem is you need to know, don't memorize, this drug, this is heart rate over here, by the way. Don't memorize this drug does this to the heart rate. You need to be able to just think it through. And if you know what receptors epinephrine, these are your answer choices. Is this one epinephrine? Or is this one epinephrine? Is this one norepinephrine? Or is this one norepinephrine? And if you know which receptors each of those drugs act on, and this is kind of a famous example, like epinephrine and norepinephrine. The big distinction is norepinephrine doesn't do beta-2, whereas epinephrine does. And if you look right here, well, what's beta-2 do? Beta-2 dilates smooth muscle. So while pretty much norepinephrine is just going to squeeze your blood vessels, it's also going to land on your heart to try to make your heart go faster, but actually you're going to learn the concept of reflex bradycardia, where when your blood pressure goes up so much from norepinephrine alpha-1 squeezing your blood vessels shut, that your body's natural reflex to high blood pressure is to slow the heart rate, and that will actually win out. So you may be thinking over here, okay, maybe that's norepinephrine, right? Whereas epinephrine, since it has the beta-2 activity, well, let's say, what does beta-2 do? Well, beta-2 dilates smooth muscle in blood vessels, okay? And so what happens, that's like, if you want to run away from a lion, you're going to need a lot of blood in your legs real quick. So all of a sudden your legs dilate all their blood vessels so that you can give them blood. And it just makes sense that your heart rate is going to go up in this instance as well. And so it's kind of by two tokens. On one hand, your heart rate went up because it needs to, because you need to run from a lion. And it's got this beta-1 activity to make your heart rate go up, but also your heart rate went up because your blood pressure or afterload kind of went down with that dilation. So that's just kind of the way you want to think. And I would just say, like, you might in your reading or whatever it is you're doing, see things like this, like, oh, okay, I see that norepinephrine doesn't have beta-2 and epinephrine does, but you're really not going to draw out the distinctions like the questions will be asked without doing a lot of CAT-SUN questions. So yeah, that's kind of it. I did really well in autonomics, so I feel confident in telling you to do it the way I did it. I'm sure there's other ways to do well, but this might worked well for me. Okay, and so then talking about the everything else section of Pharm, my kind of mantra for this is he who knows the least gets the highest score. And that's after I was a little frustrated on my first Pharm test because I basically tried to know about 4 side effects for every drug. And after the test, 3 days later, I realized I didn't know any of those side effects anymore. Like, they were just gone out of my brain. I tried to know too much. I didn't break it down to the essentials and memorize the essentials. So, out of practicality, I said, okay, I'm only going to learn as many side effects as I can learn this time, so I only learned the ones that were on Werner's list, and and I stuck with that for the rest of the year, and it was fine. I high passed Pharm. I I didn't want to try to go for honors. I thought it might be too hard. Honestly, you probably could go. I think if I'd have stuck with this plan from the start, maybe I would have got honors. But just like not trying to know too much, because you end up spending a lot of time on something that's not going to pay off for you in the long run because you're not going to know it. So I say he knows the least gets the highest score. You want to learn your systems and your receptors. So here I drew a nephron, and this is it's a really simple. A lot of this writing I just didn't bother redoing a more simple one, but I know a lot of this I don't need. It's not going to be on the test. What's going to be on the test is, where in the nephron does it work? And so I've got each of these. These are all each a cell that are a different place along the nephron, and so I can see each of these cells and which drugs work on those cells. Well, those are in the black boxes. So I just kind of have this system drawn out. I can see how it works, and I just draw my drugs right on top of it. And so once I've drawn something like that, well, I can memorize it in a lot of different ways. I could scan it into my scanner and make it answers to flashcards in Anki. That's really easy to do with screenshots. Or I could just hold it in front of me and make all my questions flashcards just using words. Like where in the nephron does a thiazide diuretic work? And then all of a sudden I'm gonna think about my picture, and I'll have it sitting there on the desk next to me, and I'll think, okay, I think it was in the distal convoluted tubule. I'll look at my picture. Oh, okay, I was right. So like that kind of thing is really helpful. So something a guy who's now a fourth year told me that really helped was just learn mechanism and side effect. And then when it comes to side effect, like I told you, just learn Werner's side effects. There's a little bit of exceptions to that. The thing that I'm encouraging you not to learn then, I guess, is indication. And I'm not saying like don't try to learn indication as in like block it out of your mind. Like try to seep up as much knowledge as you can always, but like it's not an effective way to approach pharmacology as a second year student, to really think about all the indications of the diseases you barely know. Like, okay, now there are famous drugs of choice, and your professors like to point those out, and Dr. Werner points them out, and he makes, well, at least for us, he was making the pharm tests, so if he says, this is a drug of choice, you might want to pay attention to those. I wouldn't say it's extremely high yield, but it's somewhat high yield to pay attention to. This is the drug of choice for that, and Dr. Cole will tell you a lot of good drugs of choice, and Dr. Bolton will tell you some good drugs of choice. So I would approach, rather than saying like, okay, here's a drug, what? Yeah, this is kind of simple. Don't approach it from saying, okay, here's a drug. Now, what are all the diseases that I could use to treat with this drug? That's not how doctors think. Doctors think, okay, I have a disease now, and what drug is indicated in this? And they're probably looking it up on their iPhone half the time anyway. But so I would encourage you not to try to learn indications from the pharm side of things. Learn it. I mean, I'm still learning it. I'm going to learn it as a practicing doctor, But if you can just get your mechanism of action and your side effects, you'll be okay. And then I just want to say about side effects. I'm saying Werner's side effects only. I think that would get you high pass. But it's also really good to pay attention to the physiologically obvious side effects. Werner's a big physiologist, so it just makes sense. And then utterly wild and wacky stuff like rifampin makes you pee red and your tears turn red and just stuff like that. It's interesting. It's worth knowing. I will also say about pharm, like for step 1, Dr. Werner is your best friend. Like Dr. Werner knows, he has a sense about what is going to be tested in pharm on step 1. Way better than first aid. First aid is kind of sketchy when it comes to pharm, to be honest. Like they say too much, And like, just because you can fit it all on a page doesn't mean it's not a ton of information and hard to know how to relate to each other. So I don't know. I would just leave you with that. Dr. Warner is your pharm friend. Don't make him your enemy. I really enjoyed pharm. I just kind of did whatever I wanted, whatever I thought might work for me to learn it. I rarely used the notes and rarely went to class, and just kind of like, okay, here's a new system, here's a new topic, and I'm gonna learn the mechanism. First I'm gonna learn the system, then I'm gonna learn the mechanism and a few side effects. So I'll just say a little bit about antibiotics and antimicrobials. That's kind of the third section within pharmacology. I did first aid, and I just did labs on it. Like when I study something out of first aid, I hate first aid. Like, and I never actually read it straight through, but I had felt like I had to use it. So I would, maybe the first time I would just glance over it, and the second time I would make some flashcards, and the third time through I would do the flashcards, and then the next time through I would try to quiz with somebody, and the next time through I would do, something else, another way to interact with the exact same information. If you get creative, you can interact with the exact same information a lot of different ways, and then that's really helpful. But as far as antimicrobials go, the teacher's good. She does a good job with the course. I didn't go. And she did a lot of extra stuff. I skipped that too. I was studying things besides pharm. But I feel like my classmates who went to class did well in antibiotics, and perhaps might be better prepared for the wards than I am when it comes to pharm, because I pretty much just memorized first aid. I figured, I'm going to be reviewing for boards. I need to have something that's on 6 to 8 pages. No matter how dense it is, I got to try to know something. So I went with that, and I think that's an important principle for me, is just to say, like, what's it possible for me to know, and how am I going to get through this fast right before boards. And for me, that usually means like cutting it down to the smallest amount of information possible. So the other thing that I was just mentioning is, this kind of illustrates a general principle that I like to have, is like, don't get too far out on a limb in your concept maps, or when you're just making an outline or whatever. You might be way out on a limb, and for instance, if I learned, where's a drug? Okay, here's a macrolide, and a macrolide works on a ribosome. It's a antibiotic, and so if I've gone everything down my whole outline for this drug, I'm like in antibiotics, and now I'm in antibiotics that work on ribosomes, and within that I'm on ribosomes. The macrolide, let's see, I can't remember if it's 30S or 60S ribosome right now, but you for sure want to know that on step 1 day. And then you're a couple more layers down in your outline, and then you're going to try to also remember that it's famous for interacting with P450. Like, don't do that. Take a new angle on it. Just like I'm pushing for in micro. Like, if you learned this new bug, and like, okay, it's all these layers down in your outline about it. It's a gram-positive cocci, lada. Then you're going to try to remember that it's catalase positive or oxidase positive. That's not really the way to do it. You want to grab out of that. So Dr. Chase talks about clumping and splitting, and we already talked about doing some clumping, like when you're studying these drugs. And we're saying when you're memorizing your list, you want to memorize in clumps, the clumps that Werner has. Yeah, that's a good time to clump. But the other thing, it's good to split in this case. If you're too many limbs down on your outline, you want to split. You want to just say, okay, I'm just going to make a new topic. I'm going to kind of keep a list of, in this case, it's P450 inducers. But I made a list of like oxidase positive bugs. And first aid has some good lists. I don't think they did oxidase, so I made my own on that. But just like, forget it. Like, don't waste your time trying to remember, oh yeah, this one is has myeloperoxidase or some weird kind of thing that's so hard to remember. Like, make yourself a list for bugs that have catalase and oxidase. And in this case, yeah, it's the P450. So queen barb sells fin-fin and refuses greasy carbs chronically. There you go. See that? You want to... Well, I just wanted to use that as an example of how not to get too bogged down deep in an outline when you could just make it into something new and help connect it to other drugs. On which a vignette for any one of these drugs could look pretty similar on a test. So anyway, sorry I rambled. I hope that this helps somebody, and wish you guys luck.